I'm an orthopedic surgeon with a subspecialty in hand and upper extremity surgery. I'm originally from Western Kentucky and have done my education at the University of Louisville, followed by residency training at the Cleveland Clinic. And then my fellowship training in hand and upper extremity surgery has been at Vanderbilt University. I wanted to become a physician going back to about the 6th grade. I had a career day at school and they said you got to pick something, and I had an uncle who I had always really admired, who was an internist, a primary care provider, and had always really looked up to him. And so I thought, well, I'd like to be like Uncle Danny, and so maybe we'll be a doctor. And then from that day on, I just never would let it go. I got into orthopedic surgery because of probably my love for sports. It was a difficult decision during medical school what to do. And as I went through, I just loved the surgical side of medicine, and nothing else fit my personality like orthopedics. It felt like a natural fit with my love for sports and love for working with my hands and being able to help others. The first thing I like to do is try and get to know the person. The most important thing in evaluating a patient is getting to know what they like to do and what they're trying to get back to do, because they wouldn't be seeing me if they weren't having some sort of problem keeping them from what they want to do. My approach as a physician is that this is a team game, that especially hand and upper extremity surgery, a small part of it is a surgery, and that's what I've been trained to do. But there's so much more to it than just doing surgery on folks. It's being a good decision maker in the clinic to know who will benefit from a surgery and who would benefit from a less invasive approach. It's about getting them into the therapist to get them through whatever injury or problem they've got. It's everyone else on my team that's constantly communicating and keeping open lines with the patient so that they know that we care and know that we're there to get them through this. When I came here, it felt like home. This is a beautiful part of the country, and I'm used to a smaller town. I'd always wanted to live in a smaller town. I've never been much for the big city. And when we came here, my wife and I both immediately remarked, this is like where we grew up, but it has an NFL team. And being a huge football fan, that was an incredible plus. Seeing the clinic that's been established here just seemed like something that I really wanted to be a part of.